Good morning. Thank you for joining us today. My name is Michelle Simpson. I'm the Director of Marketing and Communications for Williamson Health. We are here today with Dr. Jennifer Tatalovich, and we are going to talk about urogynecology and pelvic health. But as people are joining, I just wanted to give a recap of what Williamson Health is in case some of you are not aware. Williamson Health is the regional healthcare system here serving Williamson County and the surrounding areas. We've actually been in existence for over 65 years and have grown to 30 different locations across Williamson County. Some of those locations include our flagship facility, Williamson Medical Center, the acute care facility where we are today here in Franklin. We also have the Bone and Joint Institute of Tennessee. We have many different physician offices located across the county. We have the Turner Dugas Breast Health Center. We run all of the EMS through the 911 calls that come in through the county. So we are out in the community all over. I'm so proud to be serving Williamson County and the surrounding areas. So this morning, as I said, we're trying something new. We're trying to get our message out in many different ways that we can about all the great services that we have. And we've been talking a lot here in the office about how important this topic of urogynecology and pelvic health is. And it's a topic that we don't talk about enough in the public. And women have questions. We have concerns. We have symptoms. We're not sure what they are. And sometimes we have embarrassing questions that we want to ask a doctor. So we thought this was a great opportunity to have Dr. Tatalovich come on and answer some of those questions for us. So we're just going to begin. I would love for you to just give a recap about, who you are, what you do, why you're passionate about it, just to let people know.
Yeah, thank you so much for inviting me to be here this morning. I am Dr. Jennifer Tatalovich. I have been in the area practicing for many years now. My specialty is urogynecology, which really involves pretty much everything in the pelvis. So if women have issues really with anything from leakage to things falling down to, uncomfortable sex, that kind of stuff. I mean, these are all the things that we can treat. I'm really passionate about this field of medicine because I think it's really important for women to get to talk to women about it. Unfortunately, for a long period of time, women didn't feel like they were able to discuss these kinds of things, that these were the types of issues that they just needed to keep to themselves. And so I think just knowing that it's okay, trying to normalize that these are things that, do happen and that there's help, just making sure people feel comfortable, talking about these kinds of things and all of that. So.
That's great. That's great. We're so excited to be doing that. So thank you for being with us again. I do want to say we had several questions submitted to us ahead of time, so that was great. I have them here, and we're going to go over those. But we still invite any of you that are watching, you can still submit a question just by typing it in the chat there below. And then we also have a link. If you want to submit your question anonymously, you can click on the link that we have provided, that Williamson Health has provided right there in the chat. So keep the questions coming. We'll just start going with some of the ones that we've already had coming in. So we referred to pelvic health a few times and urogynecology, but could you explain and really describe both of those to us? What does that mean when we talk about urogynecology and pelvic health?
Yeah, it really it refers to kind of everything in the pelvis. Really, urogynecology is a hybrid of some urology, some gynecology. So really, if it happens in the pelvis, we can take care of it. And so, we do see that breadth of all the symptoms from, urinary issues to prolapse, even to some bowel issues, all of that. Pelvic health just refers more kind of to that same general area, just trying to keep everything healthy and functional, working as good as it can.
Okay, so I've heard you say prolapse twice now. So in case somebody doesn't know, what exactly is prolapse?
So prolapse is just that general term for when our pelvic organs, so bladder, uterus, rectum, where gravity starts pulling them down and potentially even outside of the body. Very common to see this after childbirth, pregnancy, all that type of stuff. So it's normal to have these symptoms, but just because it's normal doesn't mean we can't do something about it.
And what about after a hysterectomy? Is it even more common? I mean, I know you said that it could just happen after childbirth, but does having a hysterectomy increase your chance of a prolapse, or no, it just depends?
It really just depends. I mean, we can see prolapse both with people who have a uterus, both with people who have had a hysterectomy, so it can occur in either situation.
Okay, so what would symptoms be? Obviously, if it's coming outside the body,
yes,
you would be able to visually, see that symptom.
Yep.
What might be another symptom if we're not visually seeing it?
Yeah, so if people start noticing, if they're feeling a lot of just pressure, a lot of heaviness in the pelvis, that can be a sign of that. Also, if people start having kind of some of the associated symptoms, where if they're having issues with leakage of urine, if they're having difficulty emptying the bladder, that not always, but also can sometimes be a sign of that. You know, it's one of those, if you notice something different, if something feels like it's changing, sometimes women will just feel, you know, if they're bathing, they can kind of feel a bulge. Those would all be potential signs that maybe we have some prolapse. Okay,
so speaking of urinary leakage, so it's kind of a common joke among women, you know, that once we have children, you can't jump on the trampoline anymore. If you sneeze, you know, we might actually, you know, TT a little bit. But is that just a joke? Is it just kind of a common thing that happens, or is it a symptom that something might be wrong? It's not.
Yeah, it's a symptom that it's not wrong in the sense that it's something bad going on. I mean, it's very, very, very common. Almost all women are going to have some type of leakage. The important thing is we can treat it. I mean, you know, if it's bothersome, you don't have to leak when you jump on the trampoline. You don't have to leak when you laugh, that kind of stuff. So it's not a sign that there's something dangerous, but if it's happening, come talk to us. I mean, we can fix it. You know, we can really make a big improvement in those symptoms.
That's awesome. Okay, good. I'm going to keep going here. Next question. What are some of the conditions affecting the quality of life for women that you can help solve? That was one, I think, that we just talked about, maybe the leakage, but what are some other quality of life issues?
Yeah, pretty much, you know, we talked about leakage, we talked about prolapse. You know, we also deal a lot too with just the changes with menopause. And so some of the things that go along with that are going to be, we can see dryness, we can see pain with sex, you know, we can see, you know, decreased libido. We can just see generally people don't always feel really good when they transition through menopause. So those are all definitely things that we can help. We also can help with things like recurrent urinary tract infections, you know, issues with bowels and bowel leakage and that kind of stuff too. All of those things we can address.
Wonderful. Wonderful. Okay, here's a user question coming in. I'm 6 months pregnant and already experiencing some bladder leaks when I sneeze or cough. Anything I can be doing to prevent this at this point?
Yeah, I mean, at this point, I would just practice your Kegels, which are those contractions of those pelvic floor muscles. If you're already starting to notice a little bit of leakage, that's very common, especially as baby gets bigger. You're going to see more pressure on the bladder. So definitely something that we can see. I would practice your Kegels now, and then after delivery, once you've healed, you know, been cleared by your OB, at that point, I would consider doing some pelvic floor therapy, some more formal Kegels. That really can go a long way, just helping to restore everything as much as possible to kind of pre-pregnancy condition.
Great. So I love that question. So if somebody doesn't know, how do you easily explain practicing your Kegels? Is there a way to easily explain that, or resource maybe they could go research?
It's you really want to focus on trying to kind of contract all those muscles that surround the vagina and kind of think about, you don't want to push down, you want to try to pull everything up. Okay. I will say it is very challenging to do Kegels correctly. Okay. I mean, it is a very hard exercise, in part because there's so many muscles. I mean, the pelvic floor isn't a single muscle. There's many different muscles that contribute to that. And so it's not only trying to get the strength, but also the coordination, which is why a lot of times we will put people into some pelvic floor PT, some formal PT, just to help make sure they're doing the exercises correctly.
Yeah. That's great. I did not know there was pelvic health PT, so that's great. I'm learning too. Okay, another viewer question coming in. What types, I think we just answered that. What types of exercises should women be doing to strengthen the pelvic floor?
So definitely kind of focusing on the Kegel, but also things that have a lot of core work. So a lot of yoga, actually a lot of Pilates actually really does also strengthen a lot of that pelvic floor because it's so much core work. I will say in terms of pelvic floor, we do typically recommend low impact exercise over really high impact exercise. So yoga, Pilates really fit right up kind of in that category where, mostly body weight, not heavy weights, definitely not anything high impact. But there is a lot of core work, a lot of pelvic floor work with both of those. So those actually are very good for your pelvic floor too.
Great. Very good. Okay, let's see the next question. We've kind of hit on this one too, but what are some of the most common complaints that you see from women? Like if you had to categorize them.
Yeah, I mean, far and away, it's going to be leakage of urine. I mean, that one definitely I think is the most common.
Do not be ashamed or embarrassed.
Nope, very, very, very normal. That one definitely. And then I think probably the next biggest one is going to be just all the changes with menopause. Kind of that perimenopausal transition, hot flashes, dryness, having those hormones change does actually really affect a lot of the just bladder health, vaginal health, that kind of stuff. So that's probably number two.
Okay. And I did see a question that came through overnight, actually. Somebody was asking if y'all specialize in postmenopause, and I think you just answered that question.
Yeah. I mean, the nice thing about urogynecology is we really do see people of all age ranges. A lot of women really are going to start noticing a lot more pelvic issues kind of as they kind of start transitioning in. So yes, we work a lot with women with menopause and hormones and all that kind of stuff too.
And are accepting new patients.
Yes.
Yes. Wonderful. Okay, another viewer question coming in. Do most of the treatments you offer include surgery?
No, not necessarily at all. I mean, some conditions, yes, surgery really is going to be what makes people better, but we really do also have non-surgical interventions too. Physical therapy actually is a big one. Sometimes we can improve a lot of it just by strengthening that pelvic floor. We also have just sometimes replacing, estrogen. We also have some non-surgical treatments like pessaries for prolapse. So we absolutely have things that we can do that can make people better without surgery. There's a lot of medicines too that can help a lot of this stuff. So just because you're having an issue in the pelvic floor does not automatically mean you're having to sign up for a surgery or anything like that.
Great. Good to know. Okay, so here's a few more questions coming in, some of the embarrassing ones that people might be not wanting to ask about. Why do some women post-childbirth tend to accidentally urinate when doing things like jumping, laughing, and sneezing? We've talked about this a lot, but have we hit on the why? Why is that happening to our bodies?
Yeah, and a lot of it is just because of all the structural changes that end up happening with pregnancy. You end up with kind of just relaxation of kind of the structures and the ligaments, and with delivery, support is not going to be quite the same of the bladder after pregnancy, after delivery. And so if the support gets affected of the bladder and the urethra, then that urethra can't do its job and help keep urine inside the bladder. So very, very common, and not a sign of anything bad, but we can treat it.
It's something we can take care of. Okay, great. What are the potential reasons for painful intercourse, and how can it be addressed?
Yeah, most commonly, we're going to see probably that being caused by just the hormone changes from menopause. That's probably the most common reason. That's actually pretty simple to treat. It's where we talk about doing some hormone therapy. We can even do localized, just to the vagina. You don't necessarily have to do systemic hormones for that. You can also see muscle dysfunction can cause a lot of that. So same, just that pelvic floor therapy that we've talked about, we also use it for that. It can also be other things depending on the age. Sometimes we can see it associated with endometriosis. Sometimes there's some other painful, like painful bladder conditions. There can be a lot of sources actually.
Okay. Good. Next one. Is it normal to have changes in libido or sexual satisfaction? And are there treatments to increase the libido or satisfaction?
Yes. So libido does tend to decrease with age. So very, very, very common that we're going to see that. Typically, treatment is going to involve hormones, because most commonly we're going to see this as people are starting to transition into menopause, as they're getting into perimenopause. So typically we will look at hormone replacement for that. But also too, we want to make sure, there's nothing structural contributing to that kind of issue. But typically it's going to be hormones.
Okay, good. Speaking of hormones, how do hormonal changes during menopause affect pelvic health, and what can be done to manage these symptoms?
Yeah, so pretty much all the structures in the pelvis tend to be very hormone sensitive. So as our hormones are changing with that menopausal transition, we do tend to see changes just in the health of the vagina, health of the bladder, just health of all of the structures. And so as those hormones change, people can become more symptomatic from that. So a lot of that just comes down to hormone replacement.
Okay, very good. This next one I think we've hit on, but I'll say it. What is pelvic organ prolapse? What are the signs of that, and how is that treated?
Yeah, and so for prolapse, most people are typically going to start noticing kind of just pressure and heaviness. Sometimes they can actually feel something coming down. They can actually feel something into the vagina. As prolapse progresses, it can actually fall and come out. But most commonly it's going to just be pressure and heaviness. We also can see changes in the bladder, changes in the bowel. Prolapse, commonly we are going to do surgery for that, but we do have non-surgical treatments too. We can look at doing physical therapy. We also have something called a pessary, and a pessary is a device, goes inside the vagina. It's not a surgical treatment, and that just kind of helps support everything so that people don't have that pressure, that discomfort from things falling down.
So it stays in? It's like implanted and stays?
It's not, it does stay in the vagina, but it's not implanted. It's not a surgery. It is something that does need to be maintained. So people do have to take it out and clean it, but it is a non-surgical option.
Kind of like an IUD or something like.
I mean.
No, okay. Look, I'm non-clinical. It's just a device that stays in. Okay. Next question. Is there a cause or treatment for recurring UTIs?
Yes. So UTIs, super common in women. It depends on what we think is triggering it. I will say in younger women, number one cause of UTIs is going to be sex and being sexually active. If that seems to be the trigger, then that's potentially where we look at doing some sterilizing agents, where we can do some cranberry. We have some other medicines that can help sterilize the urine. We can also look at doing antibiotics just every time you're sexually active. We do actually have a bunch of different things we can do.
Did you say cranberry?
Yeah. Now, not cranberry like the cranberry you get and it's juice
Publix,
and all that kind of stuff. But there's a lot of actual just cranberry supplements, which are kind of concentrated cranberry. A lot easier to take, honestly, than having to drink a bunch of cranberry juice. But yeah, no, that actually a very simple way that can reduce your risk of infections.
Very good. Okay. Next question. What are the best practices for us maintaining good hygiene?
Yeah, I mean, pretty much vaginally, less is more, honestly. The vagina is really designed to be self-cleansing, and so we really don't recommend people to be using a lot of cleansers and wipes and that kind of stuff. Really just kind of water only to clean.
Okay.
Yeah.
Good to know. There we go. Let's see. Oh, this was an interesting thing I wanted to bring up. So a few weeks ago, Brittany Mahomes, who is the wife of Kansas City Chiefs quarterback Patrick Mahomes, sent a reminder to women on her Instagram story. And this is what she said. Once you have kids, take care of your pelvic floor. Seriously, signing it from a girl with a fractured back. Now, obviously, we don't know exactly what health issues that Brittany is referring to or what she's dealing with, but can you speak in general terms about how childbirth can affect a variety of pelvic health issues and what we can do to keep an eye on it post-childbirth?
Yeah, and I think this actually plays into a lot of the things we've already been talking about. I mean, the pelvic floor is that just kind of group of muscles that surrounds the vagina, keeps everything up inside where it's supposed to be. Childbirth, kind of like what we already mentioned, it's kind of traumatic to the pelvic floor. I mean, it causes a lot of changes, and one of the most effective things to try to get everything back as normal as possible is going to be pelvic floor PT, trying to get those muscles, functioning, tone back, all that kind of stuff. And if your pelvic floor isn't, working the way it's supposed to, sometimes that can cause issues with pain. Okay. We can also see it affect bladder. The pelvic floor helps support everything, keep it up inside. So that group of muscles is very important for having everything function the way it's supposed to.
Great. I just want to remind, we'll be getting off here in a few minutes. So if anybody has any last questions that you want to go ahead and type in the chat. Okay, here's one coming in. Do you have any advice on helping women become more comfortable talking about this topic? This is such valuable information that I wish all women talked about more. Well, thank you. I think we agree, and that's why we're here. So this is a great question. Yeah. How can we help women get comfortable talking about this?
Yeah, I mean, I think just as much as we can, normalizing that changes happen in our bodies and they're normal. I mean, it's not something to be embarrassed about. It's just part of, having kids and, gaining life experience and getting older. So, we know these transitions do cause changes. And I think just knowing that it's normal, knowing that there are treatment options out there and you don't have to be embarrassed. And, I think speaking about it with your friends so that they know, other people have this too. This is normal. And hopefully, you'll have a provider that you have a good enough relationship with that you can feel comfortable mentioning it so that they can get you, where you need to go and get you in with people that are going to be able to treat it and start giving you some solutions.
I love the idea of talking about it with your friends. Yeah. And this video will be available once we get off the live. It'll be available on the Williamson Health site. So you could even send it to your friends and say, watch it and let's talk about it. And what issues are you having? Yeah. And talk with your spouse about it too, to let them know you're learning some things and it's normal and you can get some treatment.
Yeah, okay. Absolutely.
Another question coming in, do you see similar pelvic floor issues with women who have had a C-section? That's a good question.
Yeah, it is. We do see less of kind of leakage, less prolapse with women who have a C-section. And part of that is just you're not passing the baby through the vagina, so it's not damaging the structures as much, but it doesn't mean it can't happen. I mean, you still absolutely can see changes in the pelvis, in the pelvic floor, just from being pregnant, just from all the hormonal changes, the remodeling that happens. And so just because you had a C-section doesn't mean you're not going to have these issues too, so still see issues with bladder, still see issues with support. We absolutely can still see it.
Okay, great. Okay, another question coming in. This is great. How do we get in touch with you and your office? I think I need to come see you. Where's your office located? Perfect, yes.
Yeah, so we are in Franklin. We are really right across the parking lot from Williamson Medical Center. So if you can find the hospital, you can find us. I think probably the easiest is just give us a phone call. Okay, just give us a phone call and we can set up that appointment.
Right. And you can go to williamsonhealth.org and find the Urogynecology and Pelvic Health site within our website, and it will direct you directly to their office.
Perfect.
Okay, let's see. One more. Do we have one more question? Okay, so as we wrap up, are there any, I know we've hit on probably most of it, but are there any last comments, words of wisdom, tips, things you would like our viewers to know as we're...
I think the most important thing is, if you notice something that you're not happy with, speak up.
Yeah.
There are options. You don't know what the treatments are going to be until you tell somebody. So I think just empowering people to not be embarrassed, not be afraid, just speak up. We do have a lot of different things that we can offer.
Yeah. That's great. And I would just like to say, again, thank you to Dr. Tatalovich for being with us. Thank you to each of you for logging on and listening. And we'd love to hear from y'all. If you enjoyed this topic, if there are other topics that you would like to hear from, we have a medical staff of more than 860 fantastic physicians covering 60 different specialties. So whatever the topic, we can likely have somebody come on and talk about it. So we'd love to hear what's on your mind. Thank you. Have a great day, and we'll see you next time.
Thank you.
Bye.